Understanding the Comprehensive Geriatric Assessment (CGA) model. Modern medicine has a secret that no one wants to talk about. We are winning the war against single diseases, but we are losing the battle for the person. We have become experts at treating a heart condition or a tumor, but we are completely blind to the silent, systemic collapse happening right in front of us. If you believe that a long life is a victory, regardless of whether you can still walk to your own mailbox or dress yourself, you've been sold a dangerous myth. The truth is that for those over 80, the number of diagnoses you have matters far less than a single, invisible metric: your functional independence. And right now, the system is designed to ignore it until it's too late. We are currently in the middle of a global demographic explosion, a silver wave that is fundamentally changing the face of the planet. In the United States alone, the population of those aged 85 and over is projected to triple by the year 2050. Globally, the number of people over 80 will follow that same staggering trajectory. But there is a dark side to this longevity. Nearly 85% of Americans over 65 are living with at least one chronic health condition, and a massive 60% are struggling to manage two or more at the same time. This is a state called multimorbidity, and it is the primary reason why standard medical care often fails the elderly. This documentary will uncover a revolutionary medical framework that turns the traditional one doctor, one disease model on its head. It is called the Comprehensive Geriatric Assessment, or CGA. It is the established pillar of gerontology, a multidisciplinary deep dive designed to measure and rebuild a person's physiological reserve, that hidden fuel tank of energy that allows us to survive a flu, a surgery, or a fall. We will explore why your walking speed is actually a more accurate vital sign than your blood pressure. We will reveal why depression is the single most powerful predictor of physical collapse. And we will show how this model can actually reverse the signs of frailty, keeping people alive and in their own homes longer than any pill ever could. But the CGA isn't just a new procedure, it is a total restructuring of how we define health in the final decades of life. The rise, the birth of a new strategy. The rise of the CGA model represents more than 30 years of research into a simple, unsettling fact: for an 80-year-old, the traditional hospital visit is often a path toward disaster. In a standard medical setting, a patient is assessed for a specific problem: a broken hip, a spike in blood sugar, or a chest pain. But for an older adult, these aren't just isolated events, they are symptoms of frailty, a complex clinical syndrome where the body has lost its ability to bounce back. To understand how the CGA rose to become the gold standard, we must look at the key figures who defined this new science. In the late 1990s and early 2000s, researchers like Linda Fried pushed the field forward by identifying the frailty phenotype. Fried discovered that frailty isn't a vague feeling of being old, it is a measurable state with 5 specific red flags: unintentional weight loss, self-reported exhaustion, low physical activity, weak grip strength, and a slow walking speed. If a person has 3 or more of these, they are clinically frail, highly vulnerable to even a minor stressor. At the same time, Kenneth Rockwood and Arnold Mitnitsky were developing the Frailty Index. Their research proved that frailty is the accumulation of deficits. They showed that the more medical, functional, and psychological problems you pile onto a person, from hearing loss to high blood pressure, the faster their internal reserve drains. These two models provided the scientific backbone for the CGA. They proved that you cannot fix a person by attacking one disease at a time, you have to look at the whole system. The CGA became a global strategy because it is remarkably effective and surprisingly accessible. It doesn't require high-tech machinery, it requires a multidisciplinary team. A typical CGA team includes a doctor, a nurse, an occupational therapist, a physiotherapist, and a social worker. This team works together to map 4 core domains of a person's life: medical, functional, psychological, and social. In the medical and pharmacological domain, the team tackles one of the greatest hidden threats to aging: polypharmacy. About a third of Americans in their 60s and 70s take 5 or more prescription drugs every day. This often leads to a prescribing cascade, where a doctor gives a patient a second drug to treat the side effects of the first one, which then causes a third problem. Consider the researched case of Ms. Horatio, a 76-year-old managing multiple conditions like diabetes and lung disease. She arrived at her clinic with a brown bag filled with 18 different medications. By using the CGA model, her team realized that her confusion and memory loss weren't early dementia, they were the result of a high anticholinergic burden from her combined prescriptions. By deprescribing unnecessary drugs, taking her foot off the medical accelerator, her doctors restored her clarity and reduced her risk of falling without adding a single new pill. The functional domain is where the CGA truly separates itself from standard medicine. It measures activities of daily living, ADLs, like the ability to bathe or dress, and instrumental activities, IADLs, like shopping or managing finances. Researchers have discovered a specific loss sequence for these skills. For many, the ability to bathe is the first to go, followed by walking and dressing. One of the most powerful tools in this domain is the measurement of walking speed. For people over 75, a speed slower than 0.8 meters per second is a functional vital sign that screams high frailty risk. This is why the CGA spreads so fast. It is low cost and high performance. You don't need an MRI to predict a person's survival, you just need a stopwatch and a hallway. The psychological domain addresses the silent accelerators of decline. We now know that physical decline is rarely just physical. Depression has been revealed as the single most powerful predictor of whether an older adult will lose their independence. It is associated with a 76% increase in the odds of functional dependence. This creates a vicious cycle. Depression leads to low energy and social withdrawal, which causes the person to stop moving, leading to muscle loss, more falls, and total dependence. The CGA recognizes that you cannot restore a person's walk if you do not first restore their mood. Finally, the social and environmental domain looks at the world the patient lives in. Isolation is a public health crisis for the elderly. A landmark study of nearly 2,000 older adults found that the least socially active participants developed dementia an average of 5 years earlier than their most social peers. Regular social engagement, something as simple as visiting a friend or playing bingo, is associated with a 38% reduction in the risk of dementia. The brain, like a muscle, follows a use it or lose it principle. The CGA strategy has spread across the globe because its results are undeniable. A major 2011 Cochrane review found that older adults who undergo a CGA in a hospital ward are 31% more likely to be alive and living in their own homes 6 months later compared to those receiving standard care. It saves money by reducing emergency visits and nursing home admissions, but more importantly, it saves the individual's quality of life by prioritizing the reversible areas of frailty, like improving nutrition, adjusting medications, and managing mood. The CGA provides a roadmap to resilient aging. It is the difference between simply existing for more years and actually living them with autonomy. But if this model is the undisputed pillar of gerontology, why is it still unrecognized by so many non-specialists? And what happens when we try to take this complex, team-based system and apply it to the millions of people who need it right now in their own homes? The metabolic battery, nutrition and sarcopenia. Once the CGA team identifies a person as frail, the first line of defense is often metabolic. We have to talk about sarcopenia, the meaningful loss of muscle mass and strength that affects about 20% of people by age 85. For a long time, we thought this was just an inevitable part of getting old. We were wrong. Sarcopenia is driven by a phenomenon called anabolic resistance. As we age, our muscles become deaf to the signals that tell them to grow. They require a much higher dosage of protein than a younger person just to maintain the status quo. This is where the standard nutritional advice for seniors is actually dangerous. The new evidence is clear. While a 30-year-old might do fine on 0.8 grams of protein per kilogram, a healthy older adult needs at least 1.0 to 1.2 grams. If they are already frail or ill, that number needs to jump even higher, to 1.2 or 1.5 grams. Without this protein battery, the body will literally consume its own muscle to survive, leading to the anorexia of aging and an eventual loss of independence. But protein is only half the equation. Physical activity is the other essential metabolic trigger. In fact, structured exercise is the sole evidence-based intervention currently available to stop sarcopenia in humans. The CGA model prescribes a specific tripartite mandate: aerobic, strength, and balance. Aerobic activity, 150 minutes a week, keeps the heart and lungs resilient. Muscle strengthening, 2 days a week, overcomes anabolic resistance. But for those in the danger zone of frailty, balance training is the most critical. Falls are the single greatest threat to independence, accounting for more than half of all injuries in older adults. The research reveals a highly specific solution: Tai Chi. This moving meditation has been shown to reduce the rate of falls by 19% and the number of people experiencing falls by 20%. When you combine balance training with strength and functional exercises, that reduction can hit 34%. This is clinical evidence disguised as a lifestyle choice. And then there is the silent metabolic risk, dehydration. As we age, our sense of thirst is blunted. Many seniors are living in a state of chronic fluid deficit that actively damages their cognition and balance. The daily target is higher than most realize, 3.7 liters, about 15 cups, for men and 2.7 liters, about 11 cups, for women. The metabolic domain of the CGA shows us that the body isn't just fading away, it's a system that is being starved of the raw materials it needs to stay resilient. If we can refill that reserve, we can push back the date of dependency by years. The cognitive fortress, social resilience and sleep. The final domain of the CGA model addresses the fortress of the mind. We have long treated dementia as a purely biological fate, but we are discovering that it is heavily influenced by our social environment. Social engagement acts as a neuroprotective force. It strengthens the neural circuits in the brain, making them more resistant to the pathology of Alzheimer's. This is the use it or lose it principle in its most literal form. The difference between the most socially active and the least active is a 5-year delay in the onset of dementia. This delay alone could yield a massive economic benefit, potentially $500,000 in lifetime healthcare savings per person. But this fortress is only as strong as its maintenance, and that maintenance happens during sleep. Quality sleep is not a luxury, it is the time when the brain consolidates memory and the body repairs tissue damage. In fact, sleep quality accounts for nearly half of the variance in an older adult's global quality of life. Poor sleep is a critical mediator that pulls down every other aspect of health: mental, physical, and social. Most adults need 7 to 9 hours of sleep, yet many seniors have their sleep hygiene destroyed by late afternoon naps, electronic screens, or caffeine. The CGA model recognizes that you cannot fix a person's balance if they are chronically exhausted, and you cannot fix their depression if their brain isn't allowed to rest. Conclusion: the integrated roadmap. Successful aging is not the absence of disease, it is the maintenance of function. The Comprehensive Geriatric Assessment teaches us that if we want to survive the older age wave, we have to stop treating bodies like a collection of broken parts and start treating them like a unified system of resilience. The roadmap is clear. 1. Preserve mobility, use multi-component exercise, aerobic, strength, and balance, to defend your walking speed. 2. Fuel the reserve. Meet your high-protein needs, 1.0 to 1.5 grams/kg, and hit your daily fluid targets. 3. Fight depression, address mood directly, as it is the primary thief of independence. 4. Engage in rest, build your social fortress to protect your brain and reclaim your 7 to 9 hours of sleep. Aging is a universal process, but it is not a uniform one. Your age isn't the number on your birth certificate. It is the level of resilience you have built into your physiological reserve. It is time to move beyond the diagnosis and start fighting for the person. We reply to every comment because your story matters. And if this video helped you, hit the like button, it helps other seniors discover it. Subscribe, we post new senior health transformations every day. Share this video with someone you want to grow old strong with. Thank you for watching. Your new chapter of strength begins now.